This is an insight from WellView 365, powered by freshnews.ai. Smart infrastructure is quietly rewriting waiting room operations, demanding tighter control of patient messaging and compliance workflows across facilities. Executive summary: smart infrastructure in waiting rooms connects digital displays to live clinical and operational data so that information changes automatically with real conditions. Content rules, data feeds, and governance models determine how messages such as delays, room changes, or wayfinding updates appear on screen. Done well, this turns previously static signage into a coordinated communication layer that reduces confusion, supports patient satisfaction, and keeps information aligned with care delivery. Today's signal: operations leaders are being asked to own waiting room screens and signage as part of infrastructure refresh projects tied to new capital budgets. Decisions on wiring screens into real-time data, approval workflows, and local override rules are happening on compressed timelines alongside construction and IT schedules. Without clear operational stewardship this month, new hardware will ship with ad hoc content habits that are hard to unwind and will affect patient experience scores. WellView 365 enables improved patient experience satisfaction by centralizing digital routing, field routing, and live feed control across end-to-end delivery paths. Why it matters. Here are 4 takeaways. First, smart displays now change what patients see minute by minute, so unclear ownership quickly shows up as confusing or outdated information. Second, content tied to live operations, such as delays or room changes, can either calm waiting patients or flood front desks with questions. Third, capital projects are locking in hardware and network layouts that will either support or constrain future patient messaging workflows. Fourth, regulatory and brand compliance exposure increases when more staff can influence what appears on screens without a controlled process. How it works in practice. A common example is a waiting room where new digital screens and signage are installed alongside a check-in kiosk and the EHR scheduling board. Facilities manages the screens, IT manages the network, and a patient experience manager controls the content playlist and message templates. Friction starts when live wait times, provider delays, or same-day closures need to appear on screens, but there is no clear trigger or owner for updating the content feed. When teams define simple rules like which data feeds drive which zones, who can issue a manual override, and how often clinical or legal review standard messages, patients get timely updates, fewer conflicting instructions, and staff feel fewer repetitive questions at the desk. One practical adjustment: designate a single operational owner for waiting room screens and signage this week. What to do next? Here are 4 takeaways. First, review inventory all waiting room screens, their controlling systems, and who currently changes content on each one. Second, map which patient-facing messages should be static templates and which should update based on schedule, status, or closures. Third, agree on a simple change protocol for urgent updates, including who can approve and push messages outside normal cycles. Fourth, align facilities, IT, and patient experience leads on governance before finalizing any new display or cabling purchases. Read more at wellview365.com.